Welcome back to the ACT program webinars for healthcare professionals. I'm Robin Geiger, SVP of Clinician Advocacy for Ingenovis Health. I'm excited to introduce our speaker today and looking forward to his presentation on men's health prevention. I'll start by sharing a very abbreviated bio. Dr. Shields has over 23 years of experience in nursing with extensive backgrounds in nursing education, leadership, family practice, and primary care. He holds a PhD in nursing from University of Phoenix and ANCC board certification in family practice. He also holds an autonomous practice license in the state of Florida and is the owner of Mobile Practitioners Group, a home-based primary care company. He is an assistant professor for the School of Health Professions, Department of Nursing at National University, where he leads and mentors students with focus on curriculum and practice. In addition, he is a member of Sigma Theta Tau International Honor Society of Nursing, Omega Psi Phi Fraternity Incorporated, and several other fraternal organizations that promote health, wellness, and community engagement. Dr. Shields, thank you for being here. The space is all yours.
Thank you, Dr. Geiger. It's always a pleasure to work with you and work beside you in presenting, different educational seminars, whether it be men's health, preventative health, women's health. Always a pleasure, and thank you for that introduction. I'm going to go ahead and share my screen now, and we'll get going. All right. Well, I want to welcome everybody to this afternoon's presentation. Topic for the discussion this afternoon is men's health, preventative strategies to improve and sustain health and wellness. As Dr. Geiger mentioned, I'm Dr. Shedrick Shields, board certified family practitioner, and I want to welcome everyone here. So focus of today's webinar will be things that are specifically related to men and the health of men in relation to preventive health and wellness. Again, I want to welcome everybody, and first of all, say happy summer, right? I live here in Florida, so summers are typically almost year round, but we haven't gotten into the dog days of summer just yet. But every year, of course, it always shocks me as to how hot and how humid it is here in Florida. But when it comes to summer, of course, we all have new goals, right? Most of us set our goals at the beginning of the year. Some wait to the spring, but our goal typically is to be ready for spring or summer, right? Most guys, of course, we want to get that six pack. You want to get those abs, you want to get your quads together. Whatever it is you want, you usually start early in the year to set these goals. By the time summer comes, of course, it's too late. With most of us, of course, weight loss, especially when you start getting up in age, whether it's men or women, weight loss is typically a goal of most of us who are over 30, right? When we were younger, we can eat whatever we want, right? Before I was 30, 32 years old, I could go to Krispy Kreme's or Dunkin' Donuts and eat like a dozen donuts and drink sweet juices and eat whatever I wanted and never gain a pound. Shoot, now that I'm in my 40s, I can eat half a donut and I gain 5 pounds. So weight loss, of course, will be a topic of discussion because that's very important. That's vital that we maintain healthy weight and we understand the aspects of weight loss. And of course, you can't have weight loss without fitness, right? A lot of us want to have, we get into the fad diets. We want to lose weight quickly without exercising or eating properly. So we want to improve our fitness level. And also we want to, at the end of the day, weight loss and improving fitness leads to a better control over disease and illness, right? The older we get, the more weight we gain, the less we're fit, the more we're going to be inflicted with diseases and illnesses. So right now, I'm going to let Dr. Geiger, we put together a poll. So I just wanted to kind of get a pulse on what everybody's doing now. So let's go with the first poll here, Dr. Geiger. And I will give everybody a chance to vote, and we'll kind of see where everyone's at, right? So the first poll check is, how often are you seeing your primary care provider for health prevention, right? So health prevention, not when you're sick, before you're sick. You're not when you're feeling bad, but just going, for your to your primary care provider.
Let me know if you want me to end the poll.
We'll give them a few more minutes. And
Okay.
right. So remember, health prevention is when you're not sick, and we'll go over some of those things. But go ahead and end it, Dr. Geiger. Let's see what we got here. Once a year. We got some healthy individuals here on the webinar this afternoon, right?
We have a lot of quiet people as well.
Right. Right. Yeah. 82% was only 11 that participated, right? 82% once a year for your annual physical. Hopefully you're going on your own without coercion from your insurance companies. I know a lot of insurance companies are giving incentives for employees to go to the go to their healthcare provider once a year. They're giving like discounts on a lot of things. So hopefully you're going because you want to be healthy, not because it's been incentivized. All right, so let's jump right in, everyone. All right, so I kind of alluded to this a few minutes ago about what preventative healthcare is, right? So preventative healthcare includes disease prevention, right? So that's the prevention of disease, just like it says. So things that you're going to do to prevent you from having hypertension, diabetes, obesity, whether you believe it or not, is a disease, things of that nature, heart disease, that's considered disease prevention. Health promotion, these are things that allow you to remain healthy. And there are three basic types of health promotion. We have your immunizations, right? When we're kids and we're adults, we get different, your MMR, your measles, mumps, and rubella. Now we have the varicella vaccines. We have pneumonia, influenza vaccines, of course, the COVID-19 vaccine. So your immunizations are very instrumental in health promotion. Also your screenings for early disease. So your screenings are things such as colonoscopies, prostate exams for men, and for women, it would be mammograms. Education and counseling related to behaviors that influence their health. So that's basically just talking with your healthcare providers about different things, different strategies you can do to maintain your health. And that's what they mean by education and counseling. And so that's what we consider health promotion. All right. And preventive healthcare, of course, is important because it ensures that asymptomatic disease and illnesses are discovered early. Right. And more specifically for men, your prostate screenings, your PSA testings, your colonoscopies, things of that nature are your screenings that we want to focus on as far as men. So that helps us to detect these diseases and illnesses before they are very deleterious to us, or before we start having symptoms. So when we talk about prevention, we're talking about asymptomatic disease. So once you have symptoms, then it's not considered a screening at that point. It's considered diagnostic. So the difference between screenings and preventive care is that screenings are before you have the disease and you don't know that you have it. Once you have the symptoms, it's considered diagnostic. It's no longer considered a screening. So for example, if you're a male over 50 and your bowel movements are fine, you're not having any stomach pain, everything is good, and you're going to have a colonoscopy done just for a screening, you're not having any problems. But if it comes to a point where you're having blood in your stool, stomach pain, things of that nature, it's not considered a screening at that point. It's considered a diagnostic colonoscopy. So those are the differences between your screenings and your diagnostics. All right, so that's preventative healthcare. All right, so as I alluded to earlier, weight loss is vital, especially in most of us who are over 30. As I talked about before, you start noticing a lot of your classmates start looking a little different by the time you start getting 30, right? You're like, ooh, this guy, you were in great shape, like when we were in high school or early college. And now, your body's looking a little different. You're not had a knee injury, your face is getting a little fuller. you got to start doing things differently then, right? You have to start paying attention once you get over that 30 mark for the bulk of us, right? So weight loss, healthy weight loss is 1 to 2 pounds per week. So none of that, oh, I lost 10 pounds this week, I lost 5 pounds per week. That's not healthy weight loss. In the medical world, 1 to 2 pounds per week is good. And that's actually wonderful if you can lose 1 to 2 pounds per week, but 1 is acceptable, right? Know your BMI. We'll talk about that in the next slide, but the BMI is your body mass index. So it's a medical, we'll say scientific index that we've created that kind of gives us a general idea of how healthy your weight is, right? There are some other factors, ethnicity, bone density, muscle mass, all that stuff goes into, we consider that also. We just don't go straight from the BMI. A lot of times you'll have a lot of individuals, a lot of gentlemen that'll come in my office and you say they're obese, and they get offended. But the BMI is just a clinical standard. We do weigh into the fact that if you have more muscle mass, more dense bones, we'll take that into consideration, right? With weight loss, you want to know what's your end game, right? You're losing weight for what? For health? Or you're losing it for fitness? Or you're losing it for just the aesthetics, right? What is your end game? What is it that you want to do, gentlemen? Do you just want to be more healthy? You want to lose weight? You want to improve your fitness level? You're a CrossFitter. You want to lose weight so you can do more burpees. You want to lose weight so you can do more pull-ups, right? The less weight you're going to have, the probably easier it's probably going to be if you do those pull-ups and burpees. Or just aesthetics, right? Do you just want to just look better? You want to be able to take your shirt off at the pool, right? Right? You want to, walk around the hotel with your shirt off or a tank top on and look really good. So whatever your end game is, let that be your end game, and work towards those goals. But you got to lose some weight to make sure that you're healthy, and set realistic goals. If you're 220 pounds in January, don't expect to be 180 pounds in February. That's probably not realistic. Set goals that are realistic, because that keeps you motivated. That'll keep you going, right? That'll keep you going. You don't want to get discouraged. I want to lose, 40 pounds by the end of February, and it's January 1st. Set realistic, attainable goals. And also, of course, you want to consult your healthcare provider, a nutritionist or dietitian before you engage in any weight loss program, especially when it's it involves supplements and things of that nature. You want to make sure that you're taking the right things, and that your body's functioning well enough to handle whatever it is you're taking. And weight loss is it's simple, but it's not. It's simple but complex, right? It's easy, but then it's not easy. Your calories out have to be greater than your calories in. It's very basic, right? You gotta burn more calories than you're eating, but it's hard to do, right? It's easier said than done. Weight loss is easier said than done, but basically you got to have more calories out than calories in. All right, so weight loss is vital, gentlemen. After 30, after that metabolism starts to slow down, make sure you maintain a healthy weight. Just a little more in-depth information about the BMI, the body mass index. So the body mass index is just a calculation of your weight divided by your height times 703, right? And so we got some examples there. If your weight is 150 pounds, your height is 5'5". That's how we do it. You calculate it there. 150 divided by 65 times 2 times 703 equals to 24.96, right? So obesity is considered any BMI over 30. So if your BMI is over 30, we in the medical world are going to call you obese, right? You're going to get obese. Obesity is a disease, so don't get offended, gentlemen, if you see it on your discharge report from the hospital, or your what do we give, the visit summary that we give you with all your diagnoses on there. I've had some gentlemen really get upset at me and they see obesity on there, but it is what it is, right? If you don't want to see that on your visit summary, then do something about it. All right. But if you have dense muscles and you like Arnold Schwarzenegger, that's different. But if you come in there, looking differently, than just accept the BMI for what it is and do something about it. So that's the BMI, and that is the general guideline we use to determine whether or not a person is overweight, obese, or of normal weight. Sorry. All right. And so here we have the categories. So if your BMI, again, if you're over 30, you're considered obese. Overweight, a BMI in between 25 to 29.9 is considered overweight. Normal weight is a BMI in between 18.5 and 24.9. That's considered normal weight. And you're underweight, so you're too skinny if your BMI is less than 18.5. All right, so underweight, less than 18.5. We may, as a healthcare provider, advise you to gain a little weight, but that's very rare. That's very rare. I'd rather my patients be more on the skinny side than more on the obese side, because it tends to be more healthy, and you tend to have less healthcare problems when you're more on the underweight side versus the obese side, right? And so that there, ladies and gentlemen, is how what categories you feeling that you fit into. And there are tons of apps on the phone. If you have Android or a iPhone, there are tons of apps that you can calculate your BMI on. It's very simple. You plug in your age, your weight, and your height, and it'll tell you exactly what your BMI is. If you're a fitness buff, there are a lot of other things you can do: waist circumferences, shoulder, biceps. They got fat calibers, all kind of stuff where you can determine, all the other stuff. But the BMI is just a general indication of your body mass. All right. All right. Next is exercise. We touched on that before, but exercise. You got to at least get exercise at least 5 days a week. 30 minutes a day, most days a week is 5 days a week. So that's a total of 150 minutes per week of exercise, moderate intensity aerobic activity, right? Or you can do muscle strengthening exercises, all right? So gentlemen, if you're a landscaper or you do some type of work that involves some type of physicality, it doesn't count as exercise. These need to be 30 minutes of dedicated moderate to intensity aerobic activity or muscle strengthening, dedicated. Right, not because I'm a landscaper and I'm pushing a lawnmower or I'm doing some other laborious work. That doesn't count for me. 30 minutes dedicated exercise. I know we all have a lot to do, taking care of our children, our work, other things that we have to do, but there's 24 hours in a day. I like to tell my patients that we make time for what we want to do, right? 30 minutes a day, we can fit it in. Just have to schedule it accordingly, and that's all you need. 30 minutes a day, most days a week. So at least 5 days a week. So you can do Monday through Friday, take the weekends off, or do Sunday, Tuesday, Wednesday, have your off day, Thursday, work out Friday, Saturday, and then take off another day. All right. So moderate intensity aerobic exercise, or you can do muscle strengthening. Studies have found that muscle strengthening is just as effective as cardio. Used to be individuals would, go out and bike ride, or everybody want to run or jog or do jumping jacks or whatever it is to get your heart rate up. But we found that muscle strengthening, like resistance type exercises, are just as good as cardio. After you engage in those muscle strengthening activities, the body's still burning. Your metabolism's still high. You're still burning fat. You're still burning calories after it's over. It takes a lot for those muscles to rebuild. So you can lose just as much weight as you are going to lose, or burn just as many calories that you would lose running as you would doing weightlifting. All right. I personally prefer weightlifting. I don't do any cardio, long distance cardio. I do mostly muscle training, and it keeps me just as fit as it was when I was doing long distance cycling. So don't be afraid of the muscle strengthening activities. But of course, before you engage in any of these activities, please make sure you consult your healthcare provider. Make sure you're fit enough. Make sure you got your heart is fit to handle these exercises. Make sure you got good knees, good back, makes you're examined thoroughly before you start engaging in these exercises. We very seldom tell our patients that we don't want them to exercise. So you'll rarely hear one of us say, hey, don't exercise, right? There's always something you can do. But before you engage in any training type program, make sure you're being seen by a healthcare provider regularly and let them know what you intend on doing. That's just good safety, good preventative health safety before engaging in some of this stuff. So remember, exercise, great for preventive health and health promotion, exercise and weight loss, right? And you can't get weight loss without exercise. So let's talk about vaccinations, right? So flu vaccine. All men ages 19 and older should have a pneumonia vaccine, right? I'm sorry, you should have a flu vaccine. Flu vaccines are annual. Everybody should get a flu vaccine every year. Flu vaccine typically comes out in the early fall. There are different strands every year, depends on what virus is out there. So get your flu vaccines, unless you're allergic, of course, to some of the preservatives in it or allergic to flu. I highly recommend that you get your flu vaccines annually, right? For all you gentlemen that are over 65 years and older, we recommend the pneumonia vaccine. All depends on which vaccine your healthcare provider has. You get it one time if you're using a certain one, and then the other one you get one year, and then you get a year after if you're using the PCV15. But pneumonia vaccine, age 65 and over. Shingles vaccine, I know everybody's been hearing a whole lot about that over the past year, 2 to 3 years. There's been a huge campaign in relation to the shingles vaccine, all right? So if you're 50 years and older, get your shingles vaccine. And it's a 2-dose series and it's spread over 2 to 6 months. So if you've had the chickenpox as a child, shingles comes back when you're older, typically in persons who are immunocompromised or under a lot of stress, you'll end up getting the shingles vaccine. But even if you don't, if you didn't have the chickenpox, you may have had the virus somewhere and you just didn't have symptoms. We still recommend that you get the shingles vaccine after age 50. All right, HPV vaccine, everybody through the age of 26 years old, all right? 2 or 3 dose series, depending on all ages, depending on the age at the initial vaccine. All right, so all persons, especially you gentlemen, we definitely need to get those. We need to start getting our men vaccinated before age 26. All right, HPV typically doesn't show in men, but men are the ones that typically give it to women because we're usually asymptomatic. So we're encouraging our men to get the HPV vaccine so we don't pass that along to our female counterparts. HPV is the virus that can cause cervical cancer in women, and how they normally get it is usually through sexual intercourse with an individual who has HPV, and most of the cases it's usually a gentleman that has HPV. So we want to start encouraging our young teens and young adults to get the HPV vaccine. All right, so vaccinations are very vital in health prevention, health promotion, and disease prevention, right? We want to prevent flu, we want to prevent measles, mumps, rubella, we want to prevent shingles, we want to prevent COVID, we want to prevent HPV, right? And some others. So encourage your vaccinations. There've been a lot of bad press on some of the vaccinations, but if you're not getting your information from reputable medical sources, don't believe them, right? Facebook, Instagram, all those places aren't good. Don't believe all the stuff they're saying on there. If you have a true allergy to one of these vaccines, then don't take it. That is what it is. But all the other stuff, if there's not any hard, true science or research behind it, please don't believe it. Right. All right, so prostate cancer screening. So of course, prostate cancer is specific to men. So men ages 55 to 69 years old. The evidence has changed. The research has showed that there's not a whole lot of benefit from doing the PSA testing anymore, right? So the United States Preventative Service Task Force, after they're doing their studies, have decided that men should consult with their healthcare providers to decide whether or not they want to be screened for prostate cancer. Used to be, we had men come in at age 50, 55, we do digital rectal exams and we do PSAs on everybody. But we found that the testing is more harmful than the testing, and the things we were taking the men through were more harmful than the actual disease. Most men will die from early age, from old age before they die from prostate cancer, right? And so the science is just not there anymore, all right? And so it should be a decision that men make between themselves and their healthcare provider, all right? You can see there, men over 70 years and older, the USPS recommends against PSA-based screenings, right? They're saying there were too many, what was happening where there were too many false positives, men were getting too many radical prostatectomies, and it was causing, a lot of problems in these men as far as, of course, erectile dysfunction and erectile dysfunction, urinary problems, and things like that. Prostate cancer is typically slow growing, and so most of these men probably would have died of old age before they died of prostate cancer. So the risks outweigh the benefit, right? So as of now, the prostate cancer screening by PSA is kind of on the shelf. So it should be a decision one makes with his healthcare provider. Now, African-American men, of course, are more at risk for prostate cancer and prostate cancer death. So I highly encourage them to definitely consult with their healthcare provider about PSA and prostate cancer screening. All right. All right, colorectal cancer screening, right? So remember, screenings are tests that we do when an individual is asymptomatic. Asymptomatic meaning that they're not having any symptoms at all. So if you were to decide to get the PSA, testing done or just a colonoscopy done, if it's a screening, you would have to be asymptomatic, right? Right. So if you're, having problems voiding or having blood in your urine and you get PSA testing, it's not considered screening. All right. So colorectal cancer screening. So you should receive this, all men should receive this annually, ages 45 to 75. Screening age 40 or 10 years before the age of diagnosis of a family member, whichever is early, in persons with a family history of colorectal cancer. This is the same for women as well. So if you have a close family member, a mother, grandmother, father, grandfather, very close family member that had colorectal cancer, you want to get screened at age 40 or 10 years before the age that they were diagnosed with it. All right. So colorectal screening is usually done. You can do the fecal occult blood test. They have that's when you get stool samples that determine whether or not it's blood in the stool. Or you can do the CT colography, the flexible sigmoidoscopy, or the colonoscopy. Colonoscopy is the more common screening for colorectal cancer. And most of us are familiar with that. That's typically when you'll see a gastroenterologist. They'll give you the prep to clean out the colon, which you clean your colon out, and then you'll go in and they'll stick a probe up the rectum and look at the colon wall, right? Colonoscopy screening, typically if you have a clean colonoscopy and there's nothing there, you can go every 10 years. But depending on your risk, you may have to go back every 5 years, all right? But colorectal cancer screening is very vital. So 45 to 75 annually, all right? And then your gastroenterologist will determine how how frequently you come back based on what he sees, what he or she sees during the colonoscopy. All right, so that's colorectal screening. All right. If you're over the age of 76, consult with your healthcare. The risks will probably outweigh the benefits, right? So when typically in our world, right, if they say the risks outweigh the benefits, you'll more likely die from old age than you will from the colon cancer. That's typically what that means, or it's just too risky, right? Or either that, or you have some other compounding or comorbid conditions that make it just too risky for them to either put you under or, you know, put the probe in your rectum. So there may be some risk there. But if you're over 76, consult your healthcare provider and discuss the risk versus benefits, colorectal cancer screenings. All right, lung cancer. All right, I've been on my soapbox about lung cancer for the past year. I've been noticing a lot of these hookah lounges, a lot of the I can't think of the name of those things, the vape things, the cigar lounges. They're starting to boom now. I'm sorry, did somebody say something? Yeah, okay. But yeah, the cigar lounges, yeah, those are starting to boom now. So lung cancer, right? Lung cancer is the second most common type of cancer in the United States. So you can get, most people don't realize or think they can get lung cancer from cigars, but you can, right? It's not as common as it is in individuals that smoke cigarettes, but cigars can also lead to lung cancer. Right, so cigarette smoking is the leading cause, #1 cause of lung cancer, right? And lung cancer can also be caused by pipe smoking and cigars, like I said before, and of course, secondhand smoke, right? If you're my age or older, right, we can remember when you could smoke in the inside, right? In restaurants where we're smoking, they had a smoker section in the inside. You'd be at one table, and you know, right across the wall there, they were smoking over there. They were smoking in clubs, but now they don't do any of that stuff because we found out that secondhand smoke can cause lung cancer as well. All right, so don't smoke. For all you smokers, for all you gentlemen who smoke, please stop smoking. Healthcare providers who are on here, always, you know, remind your clients of the deleterious effects of smoking. Right, every time you see them in the office, ask them about smoking. You know, become a nuisance. Hey, Mr. Jones, you still smoking? How many cigarettes you smoking? Are you working on that? You know, just become a nuisance. Ask them every time they come in. So don't let up on them, because smoking can cause a lot of, if there's anything that can cause anything, it's smoking, right? All types of cancer. And it's a bad thing to do. All right, and this is just some you know, of course, preventive strategies. Don't smoke, right? Avoid secondhand smoke, and be careful at work. You know, if you're working in some of those environments where you're exposed to, you know, some you know, environmental smoke or smog or something like that, make sure you're wearing the proper equipment that's required for your job. If that requires wearing mask or you know, some of those things that purify the air, make sure you wear those things, right? There's a number here, 1-800-QUIT now, for those who want to smoke. You know, a lot of these companies, they have a lot of government entities that'll supply you with nicotine patches, gum, and different things, right? So there are a lot of campaigns out there, and there are a lot of resources to help individuals to stop smoking. So please don't smoke. Healthcare providers, please encourage your patients as well as your colleagues to quit smoking and don't pick up bad habits, you know, with the hookahs and the cigar lounges and all that stuff. It's pretty cool looking, right? These cigar lounges are really cool. They're dark. They got all these humidors and it's really impressive looking, but you know, I encourage everybody to not partake in it. All right, and so you're screening for lung cancer, you know, naturally. We don't do a whole lot of screenings. Mostly it's just talking, right? But there are some annual screening for lung cancers, but nobody really ever does it. This also just kind of tells you, you know, how to calculate a pack a year, smoke history. But at the end of the day, you shouldn't be smoking at all, right? So encourage your friends and family don't smoke. All right. So at the end of the day, family and friends. Oh, I'm sorry. What happened? At the end of the day, encourage your family and friends to see the healthcare providers, right? Attend healthcare providers, visit with family and friends so you can know what's going on. Sometimes our family and friends will tell us, they won't tell us the whole story, right? So go with them. Wives, go with your husbands, right? I did a study, and I've seen studies where that has shown that wives and girlfriends and spouses have a huge influence on whether or not men go to their healthcare provider, right? If your husband or spouse or significant other is not going, schedule it for them. Hey, you got an appointment tomorrow. You got an appointment in 2 weeks for your physical. Schedule it. Most husbands, most spouses, usually we don't refuse. We'll just roll with the flow. But don't wait till it's too late. Don't wait till we're sick. I know most men, we're gonna wait. We're gonna wait till we're almost knocking on death's door before we'll get out and go to our healthcare provider. But get out there, get in front of it, right? Get in front of it and get out there. All right. In your communities and your family, stress the importance of preventive screenings with your youth, right? Get them, make sure they're getting their vaccinations. Make sure they're engaging in healthy eating habits. Disseminate facts, not myths, not folklore, right? If it's not fact, don't disseminate it. Only talk about things that are true, because what we don't want to do is start discouraging individuals from engaging in activities that could be healthy and that can save their lives. And last but not least, share your positive experiences with screenings and healthcare providers, right? Everybody, you get nervous when they want to come see their healthcare providers, or they think it's something bad. Let them know, there are some positive experiences with us. If you're coming for your annual physical or work-related checkups, we're not doing a whole lot of terrible things to you. We're here to help you. So share those positive experiences. Let your counterparts know that, it's not all bad when you go see your healthcare provider. All right. And so those are just some tidbits, to help men and the rest of us stay healthy. Remember, most importantly, maintaining a healthy weight and engaging in these preventative strategies will help us tremendously. All right. Dr. Geiger, I think we have another poll
We do have another poll. 1 second here. There you go.
All right, so post check 2. So after we've had our discussion, how will you or your family member approach health prevention? So what will you do now? Now that I gave you these tidbits on how to prevent the disease and promote wellness, what will you do now? Now that you've gotten these tidbits. I mean, I haven't given you everything you need to know, but I've given you just iceberg. So what are you going to do now? Are you going to have annual exams or labs now? If you haven't been, are you going to encourage someone who that to take care of themselves better, right? Are you going to review this recording because it was multitasking doing presentation? Or are you going to say, I'm proud I already follow preventive health guidelines? Which one are you going to do? All right. Let's see the results, Dr. Geiger. All right, let's see. I'll encourage someone I know to take better. Right, exactly. That's what we want, right? Proud to say I already followed. Great. All right, so we got 29%. That's saying that they already follow. That's great. And I'm glad we got 57%. Yeah, take better care of their health, right? And that's what we want.
Still a few quiet ones out there.
Right. Yeah, we got 3 more participate than the first time, right? It's 14.
There we go.
Yeah. So that's
okay. And Dr. Shields, you do have some questions. So
okay. All right. All righty. Go ahead and what have we got?
Well, first, I want to make sure that everyone knows how to contact you. And I know this isn't over. So if you want to share how they can get in touch with you if they have more questions or they would like to utilize your service, right?
Yep, yeah, exactly. If you want to get in contact with me, you can, my website is www.mobilepractitionersgroup.com. On my website, I have bubbles to where you can send me a message on Facebook, message on Instagram. I'm also on Instagram and Facebook at Mobile Practitioners Group. I'm available via chat and on both. You know, if you have some questions or you want to schedule an appointment or anything. So if you want to reach me, www.mobilepractitionersgroup.com.
Okay, great. And now you have a couple questions. I think we have at least 6 questions, so we better get moving.
All right.
So let's see here. The first one that I have, Dr. Shields mentioned some men get offended at talking about obesity. Are there any specific ways we can encourage the men in our life to get a healthy weight without being offensive? Perhaps anything he has found to be more effective when talking to his male patients?
Correct. Yeah, that's a good question. Very, very good question. Sometimes it's the approach, right? You got to know your audience. You know, some men, can handle direct advice, and some you have to coerce a little, right? So it all depends on your audience. I don't go into the exam room and say, hey, Mr. Jones, you're fat. Hey, but wordsmith it. Mr. Jones. I think we can get better control of your high blood pressure and your diabetes if we're going to lose a little weight. If we trim down on the weight, the blood pressure and the blood pressure and the diabetes get, better controlled. So let's work on weight loss, right? Or if there's some things they want to get rid of, if you have a patient or a spouse or a friend who's taking medicine and they want to get off of them, right? Hey, well, let's try, let's lose some weight. You want to, let's start exercising together. The doctor said if you lose weight, you probably can get rid of some medication, right? So give them alternatives. They want one thing, offer weight loss. But most importantly, know your audience. Know your audience. If it's somebody that you don't know, don't just come out and bluntly tell them, hey, you're fat or something like that. You gotta dress it a little bit.
Right.
Know your audience, dress it up.
Right. You have a couple more here. So we'll move through these as quickly as we can, everyone, so that we can get these. Another is, not everyone needs to lose weight. I have a thin frame. Does that mean I'm healthy though?
No, right. No,
Right.
just because you have a thin frame does not mean you're healthy, right? There are a lot of different things go into health. It's a collective. The BMI just gives us just a general view of your risks. The heavier you are, the more you're at risk for this, the more you're at risk for that. If you're underweight, the more you're at risk for this, the more you're at risk for that. But no, just because you're thin doesn't mean you're healthy. There are other things we have to do. There blood work we need to do. There's still screenings you need to follow. There's still immunizations that you need to have. We also want to know why if you're thin, you may not be eating nutritious, right? You may be, you may be malnourished, or you may be lacking some vital, vitamins or proteins. So, yeah.
Okay. Another is, my doctor says I'm obese, but I think I look great. What would you suggest I do? I like a little meat on my bones. Nice question.
That's a nice, I get that all the time.
I love
right.
that. Right.
I get that all the time. But I mean, if you're from certain ethnic groups that have bigger bones, right? We take that under consideration, but typically that's not the case, right? Typically you're not at a healthy weight. So, and most people, they know when they're really not healthy, but they want to, talk themselves into thinking that they are healthy. Certain cultures, like individuals to be a little more on the heavier side, but that's cultural, right? And so I guess health at the same time is subjective, right? It's culturally based as well, right? But in the scientific world, one thing is one thing.
Okay. And then another question, why is losing more than 5 pounds per week not considered healthy weight loss? What variables are considered when determining if a certain amount of weight loss per week isn't healthy? And I think he's referring to muscle mass or loss of muscle mass, but
Muscle mass, right? Yep.
I'll let
So,
you. Right.
yeah, basically, it's just scientifically, you can't, it's just not, if you're losing that much weight, you are losing muscle. You're losing muscle mass and you're probably losing a lot of water, right? Because you're not going, your body's just, we just don't lose that amount of weight that quickly. But there's science behind it. If you lose and usually it's water weight if you're losing 5 pounds that quickly.
Right.
Yeah, so no.
Okay, and then another one. Okay, I don't want a prostate exam like ever. What are my other options?
Right, so we've gotten away. Well, you see the evidence there is we're not doing those anyway a whole lot. You got to discuss it with your healthcare provider. But yeah, the prostate exams are now reserved for urologists. Usually do those. Now we used to do them in primary care and family practice, but now we don't do that anymore. The test now, if we do testing now, it's usually by blood, right? It's the PSA, prostate specific antigen. So it's the blood test now. We only start doing the prostate if the PSA is elevated and that type of stuff, but that's usually last result. So we're not doing the prostate exams that often. It's the first line of defense now. If it's done at all, it's PSA testing, and that's done by blood.
Okay, we got one more. Dr. Shields, this was sent twice. It says, why are African-American men at higher risk for prostate cancer, and what can be done to improve this for our community?
Correct. Good question. Very, very good question. It's just it seems like we're just genetically predisposed to prostate cancer and relative to other ethnic groups. And how we can prevent it is eating healthier, right? Eating healthy, maintaining healthier weights, and talking with our healthcare providers. Right, talking with our healthcare providers about screening. I personally still do PSA screening on my African-American male patients when they're 40, 45. I recommend PSA screening, so I'll still engage in PSA screenings. And if it's higher than 4, I typically send them to urology, right? But we don't know, right? With most cancers, we know smoking, of course, causes a lot of things. So if you're smoking, don't smoke, right? But if you're asymptomatic, just make sure you're getting your physicals. Eat right, eat healthy, exercise, and do all those things to kind of keep father time at bay, right? But those are some of the things. But encourage your family if you're African American. Encourage your family, your friends to talk to a healthcare provider about prostate screening.
Okay, and if you want to stop sharing your screen, Dr. Shields, I'm going to look and see if we had any more. You had quite a few questions today. I think that's it. I think that wraps it out. And I just wanted to add, I mean, thank you so much for covering obesity. You did just an amazing job at covering it. The CDC for men's health specifically, the ranges for all age groups was over 40%. So it's really significant. And I really appreciate you covering that and ensuring that our audience paid more attention to their weight.
Right.
Thank you so much.
Yeah.
Right. I appreciate that. I've enjoyed our chat today. Are there any other questions for Dr. Shields? I think we got them all. And, we certainly enjoyed you. Thank you for being here and presenting.
All right. Thank you, Dr. Geiger. It's always a pleasure. Anytime.
Thank you. And we certainly hope that you will join us each month as we, bring important topics from subject matter experts such as Dr. Shields, promoting health and self-care. Until next time.